I'm here today with Mark Pickering. Hello, Mark.
Hi, Andy. Good to see you.
And you are with the Christian Medical Fellowship. We'll get into all of that properly. But just give us a really brief overview of what is the Christian Medical Fellowship all about?
Thanks, Andy. So the Christian Medical Fellowship is a national charity. We're a membership support charity for Christian doctors, nurses, midwives, and their students. And more recently, we're broadening that to physician associates and anesthesia associates now that they're coming into regulation by the General Medical Council. But for 75 years, we've been supporting primarily doctors, then medical students, and then it was broadened out to nurses and midwives about 10 years ago. So we're really a workplace ministry support charity for those working in the medical, nursing, and midwifery fields.
That's actually broader than I thought. I knew that you had advice or support for doctors, and I knew about midwives. Didn't know that there were nurses was also something that it was a field that you also supported in the same kind of way.
Absolutely. So there used to be a separate charity, the Nurses Christian Fellowship, which back in the 60s and 70s was bigger than we are. But for various reasons, things changed and that faded out in the 90s. And then after a series of conversations, then they came on board fully with CMF 10 years ago. So it's really great having our nursing and midwifery colleagues in there. They're about 10% of our membership. And the idea is that we're there to unite and equip Christian doctors and nurses to live and speak for Jesus. So it's wherever their faith and their clinical practice or their career overlaps and intersects, we're there to support them in different ways.
And I spoke with one of your colleagues recently about the assisted dying bill, and her name completely escapes me, even though it was there a second ago. Was it Susan?
Susan Marriott? Yes, indeed.
Yes.
So Susan's our head of public policy. That's right. So she's one of the staff members that we've got who works in a particular area. And public policy is part of what we do. So there's various things that affect our members. So whether it's things like conscience issues around abortion and other early life issues, or end of life decision making, and particularly what's going through Parliament around assisted suicide, or issues around gender and sexuality and other conscience issues as well. We try to support our members to give them confidence about what they can do and how they can be an authentic Christian within their workplace. But also we're working with partner organizations, sometimes with legislators or the media, to try to protect that sort of environment in which Christian healthcare workers can practice authentically. You know, people talk about bringing their whole selves to work, and it's really important that we're able to do that within appropriate boundaries, of course. But that's a big part of what we do.
I'm having chatted to Richard pretty much weekly, Richard Scott, who's a current GP down in Kent. It does become quite apparent just how much importance there is on, you can't just treat with a pill someone's physical ailment without
Yeah.
also recognize it's going to affect their mental capacity, emotional capacity, and spiritual as well. So you can't just, here's a pill for that's it, fixed, because it has so many effects. So it's really encouraging to know that there are people out there who are supporting all these difficult medical professionals in various ways, because it is a really hard job to do.
It is indeed. And yeah, Richard Scott, good friend. So, he's often been, sharing faith with patients, and really important to be able to do that. And I'm really glad that we do have a reasonable degree of freedom about that in the UK. There's some good guidance that we have to follow, and we help members think through how you can do that. And, just this last Saturday, one of our team was training members down in Cambridgeshire with a package we call the saline process, which is basically about being salt and light in a medical or healthcare environment. And that's saying, well, how do you do that professionally so that you're not overstepping boundaries, getting into trouble? What's appropriate for you as a healthcare worker to be able to say, take a spiritual history, to be able to ask people, just what do you believe about life, the universe, and everything, and how does that affect you? Because you're so right, Andy, that, if we just say, well, here's a pill, off you go, that doesn't deal with the massive amount of life that comes with everything else, and the physical and the psychological. And there are so many things where in years gone by, people would go to their vicar or priest about their problems in life, whereas now they go to their GP. And that's fine for some things, but if your GP doesn't understand about spiritual issues and how that affects your physical and mental health issues, or isn't equipped to deal with that, then there's a real problem there. So we really, there's an amazing opportunity for Christian healthcare workers, again, within the right boundaries, to be able to offer some help, offer something beyond just the physical and psychological to help people orientate themselves, both spiritually as well.
Fab. Let's move back a little bit in time. Christian Medical Fellowship. Obviously, there's some obvious words in there which we can unpack in a little bit, but let's just go back in time just a bit for you. What's your story of faith growing up?
So I grew up in Yorkshire. I grew up in a Christian family. I'm really grateful to my parents and my wider family for supporting me in that. So, grew up going to church, knowing the Bible stories and going to Christian camps and that kind of thing. And then it was really when I got to sort of 12, 13 age, that was the first sort of crisis in life where I thought, okay, I do believe this stuff, but I'm not sure it's making a difference to how I live. And so probably the first really strong step on a discipleship journey that I remember was thinking, okay, the things I believe should make a difference to my day-to-day decision making, my future decision making, what I want to do for a career, etc. That's not at all to say that that was, thinking it was about a gospel of works or that God accepts you because of what you do. But it's like, okay, belief and behavior should go together. And that really set me on a path to thinking, okay, does my life reflect the things that I believe? And I guess you could say that that fits really well with what I do at CMF, because we're helping people to put their their Sunday beliefs and their Monday workplace behavior and their career together, and trying to make that an integrated whole as much as possible. And yeah, that started with me back when I was an early teenager.
I guess it's interesting how, if you go back 50 years, very much you've got a 5-day working week. Saturday would be a day off. Sunday would very definitely be a day off. All the shops in the UK were shut. Now we've got kind of hybrid working, people at home, working at work, working. And yet it seems to be that even though we've got more family time, it's like we've got less time for the family because there's less boundaries that enable us then to actually have those dedicated times.
Yeah, absolutely. And full disclosure, I was thinking exactly the same thing last night, when I'm sat here on my laptop, just doing vaguely work-related things, catching up and thinking, oh, maybe I should go and spend some time with my family. And so I did. But, it's so easy just to think, work and home and work is all overlapping.
Mm.
And we do lose that sense of boundaries, which, when you have okay, now I'm at work, now I'm at home, you can still overwork, but I think it's a whole different way for us to think about life. And it's going to take us time to catch up on, isn't it? It's like the whole social media revolution and the effect on children and teenagers' mental health, because, you're not just getting bullied when you're at school, you're getting bullied on your phone when you're home as well. And, the negative influences that might be around you, they're not just out there, they're here in your bedroom, on your device as well. So getting those boundaries between the different areas of life is such a challenge. And it's one that we really need to take very seriously.
I would imagine. I mean, we see the stories in the newspapers every so often or on the TV. Doctors walking out of work, they're going to the car, they find someone who's going into labour, and they help them give birth. I had a friend, she did exactly that. She walked out of the clinic where she was working as a GP. Oh, there's someone giving birth. Right, I'll do this. You can't really switch off being a doctor just because, okay, I'm now not in the GP practice. Well, it doesn't end, and that's the same for all of us. But of course, it's the same with the medical profession too. You can't switch off what you know when you see something in front of me that you can do something about.
No, that's right. And thankfully, I haven't passed too many people in labor in public places myself. But it's for us, it's conversations like, at church, someone talks to you about a health related issue, and then instantly you're having to think, okay, is that something I can advise you on as a friend, or do I need to say, okay, that's a medical thing, you really do need to go to your GP? Those are the kinds of boundaries that we deal with all the time. And I think on the one hand, it's really good to be able to bring some kind of expertise, knowledge that not everyone has into everyday conversations. But then we've always got to be mindful of what are the boundaries there, and how do we draw healthy boundaries both for ourselves and other people.
When I was in full-time ministry at one point, we met our boss, the vicar, out and about. I think he went buying light bulbs in a shop or something, and we met each other. But we both knew the importance of we're not going to talk about work. There was so much we could have talked about. We talked about light bulbs and what they were going to do for the day, anything that wasn't work, because it does take a degree of effort to actually maintain healthy separation. You're going to meet your vicar, you're going to meet your local GP, quite possibly if they're going to your local church. But it is important that we don't abuse that in the same context of, oh, while you're here, I've got a rash. What should I do? Because, okay, perhaps maybe there's a time for that. But also we should, as individuals, think, well, perhaps not. As an ex-trucker, somebody said, oh, can you help us move house? Because I can drive a big van. Well, that's okay. But I'm not doing it every single weekend because you know what? I want to see my family too.
Absolutely. Yeah, absolutely. I think for what we do at the Christian Medical Fellowship, we're a workplace ministry organization. So it's really important for us and other organizations like us to be able to think about, how do you take your whole self to work? How do you take your Christian self to work on a Monday through Saturday? But also, how do you learn the lessons that you've thought of or that you've dealt with in your professional life? How do you bring those into your Christian thinking? So, for instance, when people talk about healing prayer, for instance, or praying for healing at church, I can't switch off the fact that I'm a doctor, and so that affects the language that I use, the kind of things that I might pray for. Or when somebody says to me, isn't it great Jesus has done this miracle of healing? I usually say, that sounds great. Tell me a little bit more about that. Is that something that is just a bit remarkable? Or is that something that might have happened through the pills that they were taking? Or is that something really incredible? Or is it just all part of life? All healing is God's healing. So I think having those two things together, bringing our workplace skills and background into our faith and bringing our faith into our workplace, it's a really good thing to do. It's great that we feel really privileged to do that with healthcare workers, and yet it still sometimes gives you those boundary challenges that you have to think carefully about.
It's very true. I've seen it from a different perspective, but yes. So you said you're a doctor, you're working with a CMF. How did you get into medicine? And then why did you switch from medicine, I presume you living your life as a doctor, in order to work for the CMF?
So I still do a little bit of medical work. So I'll be off to see some patients this afternoon. But the way that I do that is I'm able to keep that sufficiently boundaried for it. So I decided to go to medical school as a teenager. Fairly classic thing, I was kind of interested in science and things. I was a Christian. I thought, wouldn't it be nice to do something that really helps people? I know I'll be a doctor. And then as I got into medical school, I went to medical school in London. It's actually very close to where the CMF office is today. So I really like that, being back in my student area for work as well. But getting to know the nitty gritty of that and the difficulties and the challenges of doing that was obviously just a lot of hard work and exams coming into that. But as I was a student, I got very quickly involved with the Christian Medical Fellowship. So I was part of the Christian Union linked with UCCF. And then within that as well, we also had our specialist input from the Christian Medical Fellowship. So right from the first year of being a student, I loved the fact that, as I was thinking about my future career and what it meant to be a Christian doctor, there were Christian doctors and then later on nurses, midwives and others who I could connect with, and I could learn my discipleship from them, and I could see how they did it, and I got to know professors and consultants and senior GPs and that sort of thing who were way ahead of me, or even just senior students and junior doctors, or resident doctors as they're called today, who were walking that path that I was walking, but were a few years or many years further down. So I really benefited from that right from the beginning of medical school. And for me, it was just very natural to continue with that path. So as a student, I got involved helping to edit the student journal for CMF called Nucleus. I got involved in their international branch called ICMDA, because there's over 100 Christian medical fellowships around the world who are all connected together through different networks, one called ICMDA. And I got involved in seeing people like me in different countries as well. And I was just really inspired by that real community and family. And so I ended up doing some work for ICMDA, supporting international Christian medical students for a while. And then I started to work after I graduate as a staff worker, supporting some of the students in our medical schools, just the way that I'd been supported. Then I ended up I got on the board and other things. And then now for the last 6 years, I've been the chief executive of CMF. In fact, it is just exactly 6 years this week. So it really feels for me a great privilege to be able to give back to the organization and the community that helped to shape who I am today. During that period, I trained as a GP, and then I sort of went off slightly down a side path, getting involved in secure environment GP work. So that's working in prisons and secure mental health units. So that's a whole fascinating element to how you can work as a GP as well. And then I do just about a day a week of that secure environment GP work these days, whilst mostly working for CMF.
So very much keeping your hand into active current medical stuff that's going on. Not best descriptive word, but you've got that, and then you've got the CMF as well. I love that your office is based where you used to be a student. I love these little moments that God kind of ties things together for us.
It is incredible. And actually, I mentioned it's our 75th anniversary last year. And so as part of that, we did some articles in our journal. I wrote a little booklet based on those, just thinking about what was it that led to the birth of CMF 75 years ago, and how did the Christian medical movement grow and change. And it was so fascinating, actually, that so much of that, or so many significant things happened in the area around where our office is based, just near London Bridge. So you have St Thomas's Hospital, which was linked to the cathedral that's there, and that was really sort of Christian healthcare workers, or it was sort of monks and nuns and things based around a monastery there. And then they started these medieval Christian hospitals like St Thomas's, St Bartholomew's. Then you had Guy's Hospital, which was again started by a Christian governor of the hospital who was concerned that St Thomas's Hospital wasn't doing enough for the chronically and terminally ill people, and so he started an entire new hospital there. That's where Florence Nightingale started her nursing school, in that small area as well. And again, the change from people who just looked after the sick, nursed the sick, to actually make it into a profession that really happened in the middle years of the 1800s was very much directed by Christians like Florence Nightingale, like Elizabeth Fry and others. And then so many other things that have come out of that. The whole medical mission movement that started in the early 1800s. There were some amazing connections there with St Thomas's Hospital, Guy's Hospital, and the people that came from that. So I just love thinking about the place that these things happened, the people that it happened through, and how God took one person, changed them, maybe through a difficult situation that led them to see a need and then respond to that, and then others got on board, and then a whole movement is born. So yeah, it's really great from my perspective to be able to see yourself as part of a movement throughout history, and a whole series of people that you're relying on. We talk about standing on the shoulders of giants, and how you're just one link in a chain in that Christian medical movement, or Christian healthcare movement, or for many of us in the churches and the denominations that we're part of, where we are today is so much dependent on people who've gone before us. And I just love learning from that and thinking, how do we apply those lessons to what we face today?
I know some elements of what the CMF does. I've followed you for quite a long time. Nothing to do medical. I just like, I don't necessarily understand everything that I'm reading. I like a very different perspective on some of the things that I can read, and I think that's quite healthy and right to have different ways of learning about the same subject, even if you don't understand it. There's lots I can get. The medical stuff straight over my head. However, the themes are there, which is great. But what are the sort of things that you look at the website, you look at the support? I mean, you've got that the say. I love that saline example that you've got. It's just it's so genius. But what are the things you look at and you think, I love that we can do this to help people working in the medical profession?
Yeah, well, I mean, one of the things that we're building up to this summer is a medical mission conference. So we've got 200 or 300 members of our community who are working overseas at any one time. I said we're connected through to over 100 other CMF movements, and thinking about how do we apply what we do here in the UK within the health service to resource poor countries, others who know so much about the situation that they face, but maybe they can learn from us, we can learn from them, we can partner with them. The world has changed an awful lot in over the last century. and more, and even in recent decades. So we have to rethink, well, what does it mean today for us in the West to maybe partner with other Christian healthcare workers in other countries? It's not like it was just about us, just sending medical missionaries. Very often it's, training or, helping with a particular specialist area, or maybe some sort of, governance and management, or things that we've had a bit more experience in. And that kind of partnership element is really exciting. So I'm very pleased about what's happening with our medical mission conference and connecting more with some of our European partners who do similar things in different countries. So that's exciting. And I think being able to apply the things that we know into some of the big issues in society, assisted suicide and assisted dying is one of the things that we're really focused on at the moment, because, it's not just a question of changing the law so that a small group of people can have access to some choice that they want to, so that they don't have to suffer at the end of life. Changing the law on assisted suicide will change healthcare completely. It will change how we view dying. It will view how we view disability and frailty. It will view how we deal with suffering, whether it's at the end of life or at other times. It will deal with how we do suicide prevention. How can we move from a situation from where we say, no matter what you're facing, we'll always help you to see that suicide is not the answer, and then move to a situation where, as long as you fulfill these certain criteria and you tick the right boxes, yes, we'll actually help you to end your life. How does that happen simply? That will change society in so many ways. And so it's not just for us as medics and healthcare workers who are thinking about how it will affect us. That's really important, to how it might affect our members and how we can protect them, their conscience rights, their ability to practice ethically in a new environment. But it's thinking, how will it change society? What do churches and church leaders need to know about that? If the law changes, how will a pastor deal with the fact that someone says, Pastor, I'm going to be having my assisted dying appointment next week. Would you be there with me? Would you, come and pray for me as I take the pills to end my life? That's a completely different way to manage our communities. And I think we're really honored as CMF and as our partner organizations to be able to help people think that through, train our own members, train other people, both in terms of saying, this is what it will mean for you. Please speak to your MP and help them help them see your concerns, but also to think, how can you prepare for that? Or how can we perhaps push back on that and think, I'm not sure that's the kind of society that we want to move to.
Which is a theme that I picked up. I was really privileged to chat with Dr. Trevor Stammers, who looked at assisted dying from a much more kind of international perspective of, well, what did happen in Canada and what has happened in Holland. Speaking to Dr. Richard Scott, who is an active current GP. Well, this is what is already affecting him. He's already having people asking questions, and it's not even an option yet. This isn't even possible, but he's already having that. And I'll obviously chatting to Dr. Susan Marriott as well, just from the CMF perspective, from a much more generalized, well, okay, not just GPs, but surgeons and nurses and even midwives at the other end of the birth, the life cycle, if you like. How is it going to affect what they're doing, and how as a society do we manage this? One of the things I've always respected about CMF, which is why I've been sort of following you for so long, is I really appreciate that you are speaking into difficult issues, because it's something I've watched GPs do personally. We had a lad who years ago in our youth group, we didn't quite know how to help him with certain parts of his life. We're thinking, well, if we say anything, we're going to be rude, and we don't want to do that because we want to support him as youth workers effectively. And one of our team happened to be a doctor, A&E doctor actually, and she said, I'll tackle it. And I watched it happen, and I watched her smile as she sort of spoke to him about something. And I thought, if any of us had said that, he would now be upset and broken. And she's just spoken to him as only she could and managed to deal with such a hard issue for him, which is why we need Christians who are medical professionals.
Yeah, I mean, thank you. I'm so glad that worked well in that situation. Certainly we do often have to break bad news, deal with difficult situations, just asking someone about their sexual history because they've got a problem that you might need to know about that. Where it's like, you kind of get used to awkward conversations, or, tell me exactly about how your bowel motions have changed. These are conversations you don't always have in church, thankfully, but it does help healthcare workers often to maybe go into other conversations in life in ways that might be difficult. I mean, one area that a lot of church leaders are really having to deal with is, trans identifying youth and teenagers. And that's a really difficult situation to be in. And so one of the things that we've done is to produce a resource to help church leaders, church youth workers, parents, and educators as well, to say, well, when you've got a situation like this, don't panic. Here are some of the questions you need to think about. Here is some of the evidence or support areas you might need to go to. You don't just have to do, oh, that's great that you were a boy and now you're a girl, so we'll use your different name and change everything. There are questions you can ask. There is support you can give. You can exercise caution. You can say, well, let's just pause on that. Let's just think about, whether that actually is the best thing for you. Those are really awkward conversations. And if we're not equipped to do them, we can really either say something very awkward, get it very wrong, or just say, oh, okay, we'll just sort of support and agree with you in what you've said you want to do. And often those two extremes are not the right thing to do. So we need to be able to ask wise questions. And of course, pastors are very used to doing that in particular areas. But then when there's something a bit more specialist that comes up, you really might need some help for that. And so that's something that we're happy to be able to help with in some areas, and to help our own members in terms of supporting in their own churches as well.
Which is part of what I've enjoyed accessing over the last 15 years or so, going onto the CMF website. If I'm seeing something in the news topically and thinking, I actually don't know what I'm supposed to think about this. I know that I'm not okay with it, but I don't even know why. Should I not be? I don't know. So then I kind of go and hit the website and think, okay, let me just Google this on the website. Okay, we've got something, and I can read it. And it has been immensely helpful. So how do people actually access what you've got? If it's a youth worker, for example.
Glad you've asked that question, Andy. So yeah, cmf.org.uk is our website. It's recently been sort of rebranded and relaunched. And we have a number of things on there. So there's often articles from our journals that are aimed mainly at our membership, but often helpful to others. We do write a series of blogs. So when there are issues in the news that are raising questions, if you thought about, corridor care and winter pressures, or the Supreme Court is dealing with a case right now of what is a woman and how do you define that? Or proposals to regulate healthcare managers. These are all things that we've written blogs on recently, and lots of things around the lead-beta bill and assisted suicide. So if you think, I wonder if there's a Christian medical perspective on that, go onto our website and have a look at that. You can also sign up as a friend if you'd like to. So we have membership. So if you're a Christian doctor, nurse, midwife, or student of those disciplines, do please join up as a member. You can do that, cmf.org.uk/join or /friends. And for anyone who's not in those professions, but you think, I'd kind of like to keep up with that regularly, you can sign up for free as a friend. If you just think, I'm in sympathy with the aims of CMF, then you can get our monthly newsletter and find out a bit more about what's going on. And that's a really good way to keep in touch. You can also follow us on social media. So go to our website and get the handles and things to follow us on X or Instagram and that kind of thing, and then you'll be able to find out a little bit more. So when you'll launch a new blog or comment on something, then that's there.
Mark, thank you. I know we've been trying to set this up for a little while. I know I accidentally emailed you last year about car imports, which wasn't quite the right mark on my calendar. But these things happen in life, don't they? That's just a silly example. But even though that's a silly one, there are serious ones where we can get it wrong. And I'm really glad that we've got somebody we can turn to in the CMF. I didn't know it was 75 years. That's kind of cool.
It's great, isn't it? And I think, I love the fact that we've got people in CMF who are in their 90s, and we've just about moved beyond having members who remember what it was like before the National Health Service. That generation is sadly dying out, but we've got people who have been part of CMF since the 50s and the 60s, and they're very elderly now, but they've got great stories. And it's always lovely when people meet up at conferences and, they get to inspire the students by some of the stories that they tell and just the way that they're remaining faithful now. And they get inspired by the students and younger members and the things that are happening. And it really is a community. And you don't, outside of a church, you don't often see that in society. People are not often part of that community, from, young people right through to working age and retirees, especially with a particular a particular area of interest and where you can help and support each other. So I really do value that. It's one reason why it's a great privilege to be part of leading CMF.
Mark, thank you. If you want to know more, cmf.org.uk, and you can get all the information you need and more as well on all the sort of stuff that's topical. Mark Pickering, thank you.
Thanks, Andy.
Other areas of support are available, which we forgot to say. We're putting this bit in, but what are some of the other organisations that are around who can help people involved in medical profession?
Well, and lots of other professions as well. So thanks, Andy. You know, we've talked mostly about healthcare workers here, but the wider area of workplace Christian ministry is really important. And so we're really proud to be part of a wider organization called Transform Work. So you can go to their website at transformwork.net. And they really work in two areas. So the Christian professional sector groups like CMF, there's the Lawyers Christian Fellowship, the Association of Christian Teachers, the Christian Dental Fellowship, Christians in Pharmacy, Christians in Media, lots of others. And you can go onto their website and find out. So if you think, I'd quite like to meet with other Christians in my profession and think through the issues that are relevant for us, go and have a look at the Transform Work website. You can find out there. Or if you're just part of if you just work in a significant sized company and you think, wouldn't it be great to have a Christian workplace forum within our company? There are hundreds of those around the country. And if you want help either finding that or helping to set one up, then go on to Transform Work as well. And you can find out some advice and support on how to do that. And you may just find that there's already a group of praying Christians within your workplace that you never even knew about or within your industry. So do go and have a look there and see what you can find.